Have you ever wondered why some people seem to develop allergies and asthma while others don't? You might think it's just bad luck, but what if I told you there's a hidden factor at play that could explain why certain people are more prone to these conditions? What if I told you that this hidden factor is tied to your genes and could be affecting your health in ways you've never even considered? In this video, we're going to uncover the mysterious connection between a genetic trait known as atopy and the rise of asthma. The link is more powerful than you think, and it could change how we approach prevention and treatment. Stay with me because by the end of this video, you'll have a whole new understanding of why asthma develops and, more importantly, what you can do about it. Ready to find out? What is atopy? Atopy is a genetic tendency to develop allergic diseases, things like asthma, eczema, or hay fever. Basically, if your family has a history of allergies, you might be more likely to develop them too. But how does this happen? When you have atopy, your immune system is primed to react to harmless substances, like pollen, pet dander, or dust mites, like they're harmful invaders. This response is triggered by a specific antibody called immunoglobulin E. Now, you might be wondering, what exactly does immunoglobulin E do? Immunoglobulin E is the key player in allergic reactions. When someone with atopy encounters an allergen, their immune system produces immunoglobulin E antibodies that bind to cells called mast cells. These mast cells are located in areas like the lungs, skin, and digestive tract. When the allergen enters the body again, the immunoglobulin E on the mast cells triggers them to release histamine and other chemicals. These chemicals cause the inflammation and discomfort that we associate with allergies, things like sneezing, itching, and swelling. But when this happens in the lungs, it's more than just a runny nose. It can cause bronchoconstriction or the tightening of the airways, making it hard to breathe. In the case of asthma, this leads to coughing, wheezing, chest tightness, and shortness of breath. You might be wondering, so what does all this have to do with asthma? Well, atopy is actually one of the strongest predictors for developing asthma. Studies show that people who have a family history of atopic conditions, like eczema or allergic rhinitis, are at a higher risk of developing asthma. It's common for someone with asthma to also suffer from other atopic conditions, meaning they share a similar immune system response. These conditions are all linked by an IgE-mediated allergic response, where the immune system mistakenly thinks harmless allergens are dangerous. So, atopy and asthma are deeply connected through this immune overreaction. One theory that helps explain the rise in asthma and allergies is called the hygiene hypothesis. The idea is that in today's cleaner environments, children have fewer opportunities to be exposed to microbes and infections early in life. In the past, kids were exposed to bacteria, viruses, and other pathogens that help train their immune systems. These exposures help the immune system develop a balanced response, protecting against harmful infections and not overreacting to harmless substances. However, in our modern sanitized world, many kids aren't getting that early exposure. This means their immune systems may become overly sensitive and more prone to allergic reactions, leading to an increase in asthma and other allergic diseases. It's important to note that while atopy is a major factor, asthma is a multifactorial disease. This means there are many different factors that contribute to it. Genetic, environmental, and lifestyle factors all play a role. For example, exposure to tobacco smoke, either before birth if the mother smokes, or during early childhood, greatly increases the risk of developing asthma. The harmful chemicals in tobacco smoke can cause inflammation in the airways and make asthma symptoms worse. Similarly, obesity has also been linked to an increased risk of asthma. Extra weight can contribute to systemic inflammation, which in turn may make asthma symptoms more severe. And of course, air pollution and living in urban environments are also significant risk factors for asthma. But despite these environmental influences, atopy still stands out as the most powerful predisposing factor. Atopy is the strongest genetic factor for asthma because it directly influences the immune system's response to allergens. The genetic tendency to produce IgE antibodies means the immune system is more likely to overreact, setting the stage for asthma to develop. So, while things like smoking, air pollution, and obesity can increase the risk, if you have the genetic tendency for atopy, your immune system is more likely to trigger the cascade of events that lead to asthma symptoms. Understanding this connection is vital. whether you're looking to prevent asthma or manage it better. If you can identify the genetic and environmental triggers early on, it may be possible to reduce the severity of symptoms or even prevent the disease in some cases. So, how can you manage asthma, especially if you have a genetic predisposition to it? For individuals with a family history of atopy, the goal is to reduce exposure to allergens from an early age. This might mean using dust mite-proof bedding, keeping pets out of the bedroom, or avoiding places with high pollen counts. For those already diagnosed with asthma, there are many treatment options available. Medications like inhaled corticosteroids can help reduce airway inflammation, while bronchodilators can open up the airways, making it easier to breathe. More recently, biologic treatments such as monoclonal antibodies that target IgA are helping people with severe asthma get better control over their symptoms. Lifestyle changes also play a crucial role. Maintaining a healthy weight, avoiding tobacco smoke, and getting regular exercise can all help reduce asthma symptoms. To wrap it up, asthma is a complex condition influenced by both genetics and environmental factors. Atopy plays a major role in asthma's development, as it primes the immune system to react to harmless allergens in ways that lead to asthma symptoms. By understanding the genetic link and managing environmental triggers, you can take steps to prevent or control asthma. If you found this video helpful, don't forget to hit that like button, subscribe to the channel for more insights on asthma and allergy management, and check out our other videos for more tips on improving your respiratory health. Thanks for watching.